Hello everyone, this is Mr. Klein. I'm going to review with you today Nursing 250 orientation. On July 7th, we're going to start the day on campus, face-to-face, doing the required dosage calculation exam. You will have the opportunity to use a calculator in up to 30 minutes to complete this 5-question exam. If you get more than one or more wrong, you will have a chance to remediate. The key thing with this dosage calculation exam for Nursing 250 is that you need 100% to pass. After your first 2 chances on the first exam, you still need to make up the full 5-question exam. Basically, you have 4 tries to complete this perfect score on this exam. Students who do not get a perfect score, meaning 100%, they do not get all questions correct after 4 attempts, will be withdrawn for Nursing 250. Nursing 250 is a turning point in the HACC nursing program. Keep in mind that you're in your final 2 courses at HACC before you become a registered nurse. So the content, the exams are much more difficult in 250 than ever before, and that carries over into Nursing 251 that you'll have in the fall. So this is some of the preparation today that we're going to review. Just so you have an idea of how much time you're going to have to devote to this course and, of course, Nursing 251 in the fall. This slide lists your nursing adjunct faculty, specifically your clinical faculty for Nursing 250 this summer of 2022. On the left are the med-surg faculty members, as you can read there, and on the right are the 4 community instructors who will be with you at some point in time at our low-income housing unit in downtown Harrisburg called B'nai B'rith. Keep in mind that all your nursing faculty will be in contact with you closer to the time that clinical begins. Give them the week of clinical to contact you regarding their expectations, their specific guidelines, where to meet them, and so forth. The Nursing 250 class syllabus is on the D2L course shell. It will also be printed for you to have a paper copy as well. Do keep in mind, just as previous nursing courses at HACC, you are completely responsible for everything that's listed in the syllabus. What I'm going to do now for the next several slides is highlight specific important areas. As with other syllabi that you have from HACC, for the most part, the syllabi are very much the same. Where things change usually is involving grading, attendance, and of course content, of course what's covered on exams, what is covered week to week in class. Here highlighted in yellow is a health assessment that you want to ensure you have that paper copy available for this course and keep it for 251 as well. Also highlighted here, pointing out as far as testing, remember we are coming back to campus now, once again as we did in 241 for tests. And after tests, we're going to be going back to our classroom to have face-to-face in-person class. That will vary according to the schedule, if we can do Zoom classes or not. For the most part, with Nursing 250 this July into August, we're only going to have 1 week which we can do remote class by Zoom. All other classes, 5 of your 6 classes, will be in person. This highlighted in yellow on the right side of the screen indicates for those students who are not keeping their schedule as far as not keeping their schedule as far as testing makeup is concerned, you're going to be losing 5% to as much as 10% regarding your grade with failure to properly schedule a makeup test in Nursing 250. And again, in yellow to the left side of the screen is indicated how much 5 and 10% equate to as far as the number of missing points for the exams that you'll be taking in 250. Bottom line is, if you need to miss an exam, do schedule with me as soon as you can or with the testing center so you can avoid issues like this. Now, with the testing that you'll be doing for Nursing 250, you may use calculators. I want to ensure that that is clear. Looks like this screen, which I didn't catch this from a previous instructor, looks like they didn't allow students to use calculators, but you may for me, because you can in NCLEX testing situations. Again, this information here is basically the same as in previous semesters, reviewing what we do as far as remote testing, regardless if it's course-specific tests or ATI tests. What will be different for you now going into summer, just like we did with 241, is we're going to have in-person, face-to-face tests that still will be ATI and D2L as far as the delivery mode. We'll be taking these exams in the Blocker building for the most part. With the lab now being open by June, we can once again reissue lab remediation procedures where you actually have to go back to campus and remediate if your clinical faculty feel you need to do so. So that's what's addressed here in yellow to the left side of the screen. To the right side of the screen, here we're going into the grading schedule as far as how many points are required to get an A, B, C, and so forth. Delayed schedule. Usually in the summer we do not have any weather-related issues. However, there could be flooding from severe storms. There could be tornado watches. We've had tornadoes in Lancaster, York, in the Harrisburg area over the years. So if there is a severe weather event, I will notify you through D2L, or I will notify your clinical faculty who will notify you if it is a clinical day. And it will be the same process if we have a severe weather condition where we can't meet on campus for class or tests. I will notify everybody by email if that sort of thing would come up. Usually weather is an issue during the winter time, but again, it can happen in the summer and fall. Teaching schedule is also in the course shell on D2L. Always review it prior to class so you know what readings to do. And very important, also know what chapters to review as well for your tests. This color-coded graphic is here to give you not just the testing schedule, but the many different tests that you're going to have to complete for both D2L and ATI during Nursing 250 this summer. Again, looking at the top of this chart, basically, week 1 on July 7th, we're going to begin the morning in our own building with the dosage calculation exam, basically almost for the first hour. Then we're going to go right into lecture, which is going to be community. During this same week, July 6th, the day before class begins, you have a short assignment due for community. For community and for med-surg, this is how Nursing 250 is divided. For you, you have class only 1 day a week. For the traditional HACC students who are full-time during the work week, or Monday through Friday, they meet twice a week. The evening weekend students who are not stacked will also meet like you do once a week. So your tests, your assignments come up more quickly as far as a time frame than your classmates who are taking Nursing 250 through the regular work week, Monday through Friday. So you have a lot more things due sooner than later. So the first week, week 1 in yellow, you're going to have your dosage calculation exam on campus, followed by the need to turn in by Dropbox this community classroom assignment number 1, which we'll review in class. And then we'll have class following the dosage calculation exam on July 7th. Week 2 is in green. This will be our one and only day that we're going to be remote. That will be June 14th. However, the day before class, which will be that Wednesday, June 13th, you have another community assignment that is due. These community assignments, again, are well explained on your D2L Nursing 250 course shell. And the point of doing these is to give you some time to spend thinking through the questions that these assignments challenge you to answer, and then we review them in class. Then you see there's class then, again by Zoom, during the second week of class. The third week of class in blue, which is July 21st, you have your first exam during the first hour of class. Keep in mind that Nursing 250 is shorter in length than Nursing 241. So we're only in class from 9 a.m. to about 11:30 Thursday mornings. So we have not much class time anymore once we get into 250. So we lose about half our class time to tests throughout the month of July into August. Following exam 1, we're going to spend the rest of the morning doing a review of the arrhythmias, EKGs. Then the fourth week, there in orange, July 28th, you have your proctored ATI Med-Surg exam, which is 100 questions. It consumes the entire class day. Actually goes over because you do have additional time to do 100 questions. On this day as well, a special assignment that reviews EKG strips, arrhythmias is also due that day to Dropbox. Week 5 there, in kind of a flesh color for August 4th, is your second exam. That's going to be an hour long also. It's going to be in the Blocker building. After that exam, we're going to have a lecture on shock. It is this day as well, on August 4th, that your Med-Surg EKG quiz is due. And then that same week, August 7th, you have ATI practice exams that are due. There's 2 of them, exam A and B. There's also a time which you want to complete by August 7th, which is the end of the course. It's a Sunday. You want to ensure that all your ATI exams assignments are completed by that date, which is again Sunday, August 7th. Everything has been set as far as a time of 11:30 p.m. for all assignments. And finally, on August 10th, there is a Med-Surg EKG quiz that is due to Dropbox also. And then your final exam is going to be on August the 11th, that final Thursday that we meet in August from 9 to 11. And again, that is going to be on campus in the Blocker building. So we'll keep going through these assignments, but keep in mind for 250 is about community health in Med-Surg. So you're going to have projects and tests focused on community, projects and tests focused on Med-Surg. Med-Surg is going to be covering EKG and shock for the most part. That's what it's covering. And community is getting into public health, home health, as well as community health in the sense of addressing the needs of the underserved, which would be people who live in very low income or no income, the homeless, as well as those that have been released from jail, incarceration, immigrants who come here without financial support, or any support that have healthcare needs. So I think you'll find it interesting. Most students do not look forward to doing this type of clinical or course because it's not the excitement or interest or high tech that critical care or ER nursing brings, but many find it to be very interesting because community health is serving our community in which we all live. And students, their eyes are open to the struggles that many people in our community that are living around us suffer through on a daily basis that we do not have to. So again, this color-coded chart, please refer to it. I'll be referring to it to keep us all on track so you don't miss any assignments or tests. Point distribution, remember there's 100 points total for Nursing 250. The magic pass number is 75. You got to have 75 points to pass Nursing 250. I will tell you that Nursing 250 is the most important, most difficult course in the HACC nursing program. About 10% consistently of all HACC campuses that teach nursing, 10% of the N250 students do not pass Nursing 250. It is a difficult course, even if it's twice a week that you meet to do it, because of the content, the level of knowledge, understanding, the critical thinking that you need to apply, the ability of you to think outside the box, to learn and study more on your own is now. So that's what makes this course so much more difficult than what you're used to. It's not impossible. Again, 90% of students enrolled in Nursing 250 pass. However, there is that group of about 10% that do not, and it's across all HACC campuses that offer nursing. With ATI, primarily you're going to have two course exams. The first exam is going to cover community content. The second course exam is going to cover med-surg content, EKGs, and sepsis. Then your final course exam will be cumulative. It is a requirement of the nursing department of HACC that the exams for Nursing 250 and 251 you'll have in the fall, are cumulative exams at the end of those courses. So up until now, I've been able to split your courses so that we can not have cumulative exams. However, in 250 and 251, you will have cumulative exams. Part of the curriculum for Nursing 250, this will also mean 251, you do have ATI-specific assignments to do. So the first one's due by July 14th. This would be the second week of class to Dropbox. It's a met not met assignment. This is set up in ATI, so when you go in there, you'll be able to navigate as far as what you got to do. Basically, based on the ATI practice exams that you're taking, you're going to figure out what areas that you need to practice or develop your knowledge in. So it could be pharmacology, it could be fundamentals, it could be something else. So what you want to do in the Nursing Logic 2.0 modules is you want to look at the list of available topics and choose up to 4 in areas that you need to remediate. That's what this is about. It's just giving you more practice because we really, truly want you to do exceptionally well on NCLEX. When you graduate from HACC, we want you to go and take that NCLEX exam only once. Get it done in 75 questions. That's our goal. So doing all this ATI stuff is going to help you reach that ability to do that. This comes out of the syllabus. It's one of the last few pages in the syllabus. Again, it's online in D2L in the D250 course shell, and it's also going to be printed out that you can refer to it in paper form as well. Basically, 250 again is split between community content and med-surg content. So you have classroom activities listed here. You're going to get a point for each classroom activity that you do. You're going to get 2 points total for the 2 community projects that you do. And they're not lengthy at all. These are due by Sunday, August 7th. You have to get a score of 60% or greater to get your point. For Med Surg, this is going to be a primarily involving the EKG assignment, which is a multiple page set of EKG strips where you're going to have to do the measurements as far as the heart rate, the PR interval, the QRS measurements, and then a EKG quiz. Again, doing well on both will get you a point. The Med-Surg exam, which is in ATI, well, the Med-Surg exam number 2, which focuses on your EKG content and sepsis content for the course, it will give you 24 points. With all the ATI assignments you have to do in Nursing 250, which encompasses the ATI exams A and B, your proctored Med-Surg exam that we do on the last day of class with the final, plus your 2 community projects and your 2 Med-Surg projects, give you a total of 8 points for ATI. And then your final comprehensive exam, which is 40 points or 40 questions. And remember, comprehensive final, you're going to have for 250 and 251, gives you 40 points. This breaks down the ATI proctored and practice exams. Again, for Med-Surg is listed on the left, community is listed on the right. You're going to take both these exams. These are going to tell you what you need to remediate, what topics, what information, what concept do you need to practice to do better on, to be more successful in passing the NCLEX exam. Again, all your ATI assignments, these practice tests for ATI are due no later than Sunday, August the 7th through Dropbox. In the Med-Surg and community practice exams, when you do your remediation, there will be templates to complete. They could be meds, they could be concepts, medical diagnoses. Those templates must be handwritten. We want you to handwrite them because it helps you retain information versus this copy and paste in text. If they're not handwritten, they're copy pasted, computer generated text, I will not accept them. You won't get your point. And finally, there will be a proctored ATI Med-Surg exam on Thursday, August 4th. This again consumes our entire class day. Again, we'll be on campus. All tests, regardless if they're ATI or D2L, are on campus. Now your practice, anything that's practice exam, ATI practice exams, you can do at home, you can do them at the beach, you can do them at work, wherever. But if you have a proctored exam, ATI proctored exams, your course exams, your exam 1, 2, and final for a 250 will be on campus. Again, just like previous ATI exams that are proctored, usually through Zoom that we've been doing, but now we're going to be on campus. Depending upon the level that you score, determines how many points you get. So you can get a point for as many as no points to as maximum amount of 4 points. Again, the proctored exam we're going to be doing on campus, and I believe that will be at the Blocker building also. This screen here just breaks out the specific assignments because with 250 there is so much to do in such little time. Basically, we have 4 weeks of class content. The remaining 2 weeks are all about tests. So we lose a day to your ATI proctored exam, which takes the entire course time of 2.5 hours, and then we lose week 6 to doing the final. So for you and for myself, to keep things organized as far as what fits with what category. ATI is the top in like this pinkish red. ATI assignments for Nursing 250 encompass your focus review and templates that you handwrite that get you 4 points. The med-surg proctored exams that you're going to take on campus at Harrisburg can give you up to another 4 points. Your community assignments and exams are there in yellow in the middle of the screen. Your community classroom assignment number 1 is there for 1 point. The second assignment, you can get up to a point for that too. There's an ATI exam B that you can do on your own time. That can give you a point there also. And then your in-class course exam covering community content can give you up to 23 points. And then finally, mirroring that would be the med-surg content. For the most part, med-surg content for 250 is going to be cardiac and sepsis. So in the med-surg assignments and exams, that hot purple color at the very bottom of the screen is going to be the med-surg assignment of an EKG quiz. Gives you 1 point. There's an EKG study guide. The EKG study guide, and again, all this stuff is explained in detail on the N250 course shell. You can go in there and you can get verbatim, and you can download everything in paper to tell you exactly how to fulfill the needs of all this stuff on this screen. The EKG study guide, you have a week to do. Again, it's this multiple pages of EKG strips to measure and determine what the rhythm is. And then I can release the answers. You can use it as a tool to review for the final and for the EKG quiz. Again, that you can get a whole point for. In sum, at the very bottom in green would be your cumulative final, and then the maximum points for the course is 100. Remember that you only need 75 points to pass the course. Do keep the nursing handbook handy. It's available in D2L. Remember, you are responsible for everything in that handbook. Nothing's changed in the handbook since January. They basically update it by the college, updates it every year, typically at the beginning of each year. And those updates have been added to the handbook that you have available to you as a download for Nursing 250. What I do want to point out, because there's been an issue I've seen with Nursing 240, and I'm hoping that it doesn't change as we go in through 241 into 250, is the fact that students will come to campus, take exams, and go home. They skip class. Well, the problem with that is, on page 41 of your nursing handbook, again, you are responsible for knowing this on your own. This is why I'm pointing this out, that if you have unexcused absences that exceed 15% of your total course time, you can be dropped from the course. So keep this in mind if you miss more than 1 day of class, because to being considered being in class means that you're in class for the whole time. You're not coming to campus this to take an exam and go home, that you're staying for the entire day. And again, with Nursing 250, we're there from 9 a.m. to 11:30. It really is the shortest course that you're going to have. You're going into fall with Nursing 251. That's going to last from 9 a.m. to 3 p.m. Much longer day, and again, it's going to be on campus. So if you're skipping lecture class after taking an exam on campus for Nursing 250, you run the risk of being dropped from Nursing 250 with the second unexcused absence. I want to point this out because I know several students may try to do this, and I don't want to lose students over a attendance issue as they're trying to complete their program. Retention and test taking. If you're having significant issues with passing Nursing 250 exams, trying to figure out how to study for exams, just learning the content, reach out to Mrs. Christina Johnson. She is our UPMC clinical contact person. Her email is there. Please use that email specifically because she's very strict with what emails we use for which reasons. So Christina is both a UPMC employee and a HACC employee. So she's one of our tutors here at HACC Harrisburg. So do take advantage of her services if you need her. A little bit about clinicals. We all should know by now the clinical schedule because it's been out since our Nursing 241. We do have a few new students who are coming in just for Nursing 250. So the nursing clinical schedule will be new to them, and I will reach out to them to help them specifically. This screen's just back up. This is a reminder of what to do if you should come in contact with COVID, if you should be coming down with symptoms of COVID, if you're tested positive for COVID. Main thing is to go to the HACC website and complete the information there online, and then await an email from the college as far as what to do. With clinical, the main thing going into Nursing 250, we're going to continue wearing 3-ply surgical masks at all times. We do not need to shield unless UPMC would change its mind. For Nursing 250 in the fall, you do need to have fit testing. You do not need to be fit tested for summer clinicals because summer clinicals are community and med-surg. We do not have to be fit tested. We do not wear the N95 masks for the clinicals in summer. But fall, you absolutely need to be fit tested. So watch out for email. Do go back through email that I sent out in May regarding testing for N95 fit testing at the Harrisburg Hospital sites. That has to be done by the start of clinicals in the fall, or you won't be allowed to go to clinical. Our tool remains electronic at this time. If it does change the paper, I will get the paper copies out to you, but we're planning this summer to have a digital tool, which I've created, and it will come up once you start placing clinical paperwork into your Dropbox. You'll see the tool there being completed by your clinical instructor. If you should get a lab prescription for remediation, again, you're going to have to reach out to your clinical instructor, and then someone in the lab will reach out to you. This last line, which I need to remove, talks about making an appointment to come to campus. At this time, you do not have to worry about having an appointment to come to campus. We are open here in the summer. Lab will have open lab hours that you can go in and practice in the lab, but the main thing is if you get a lab remediation prescription, do follow up with your clinical instructor, with me, and then an instructor from the lab will contact you to set up a time for you to come in for remediation. Reviewing back to the ATI Nurse Logic 2.0 priority setting frameworks tutorial. Again, this is a module that you need to complete by July 14th, 11:30 p.m. You're going to, again, going to be doing this module, which involves a test, and the test determines your weak areas as far as your nursing knowledge, and then what you should do with the Nurse Logic 2.0 tutorial is pick 4 areas that you're weak in and use those 4 areas to complete this Nurse Logic assignment. And again, there'll be templates that you need to, again, handwrite before you Dropbox them, because again, if you type or use someone else's material to create the templates, they're not going to be accepted. We want you to handwrite them. Just some information regarding clinical practice, specifically with Nursing 250. We want to always label our syringes. We don't label the vials. We don't tape the vial to the syringes, because taping a vial of such as like morphine to a syringe, if that should come loose and be dropped or misplaced, we still don't know what's in that syringe. So you always want to use a sticker at UPMC, which is where our clinical is going to be for Nursing 250 this summer. You have in their med rooms, because all their med rooms are identical, regardless of where you go in the UPMC system, you will have stickers that you can complete with your patient name, drug name, dose, and how fast you administer the drug. This is very serious. This is very important, and we do want to instill with you the importance of properly identifying your medication. So this is something that you can definitely get a NotMed for, and possibly get a lab remediation prescription to go back to the lab practice, because it's very important that you properly identify your meds, particularly IV meds. Just a review of parking for you specifically. This is mainly for students who are at Harrisburg Hospital through the weekdays. For you, you can park in the Brady parking garage. Brady specifically. You will have parking vouchers. They are return address labels that have barcodes on them. Use them to park for free in the Brady parking garage on the weekends for clinical, which is Saturday and Sunday. Keep in mind, if you're using these vouchers or stickers other days of the week, security is going to know, because every time you scan them to get in, because you have to scan the barcode on the sticker to get the gate to open to enter the parking garage. Security is going to know the date and the time. And these stickers are coded, numbered, that security knows exactly who you are as far as you're a nursing student from HACC Harrisburg. So we do not want you to take advantage of this, because if security is saying HACC students from Harrisburg are violating the parking rules, you may not be able to park at the Brady parking garage. You may have to walk to get to clinical from another parking area. So we don't want that to happen. So please use your parking vouchers, these stickers, which I'll give to you during the first day of class for Nursing 250. Use them correctly. Just a reminder for those students, and this is probably going to be students that are new to HACC who are transferring in from other schools into Nursing 250, you must have your net learning modules completed to attend Nursing 250. You cannot attend clinical at UPMC without getting your nursing net learning modules completed. It does take some time, 6 to 8 hours of time, but it's something we all have to do. Even faculty have to do it, and we have to do it every year. If you do it currently in the month of May through July, you'll be set now for the rest of your clinical program. You will not need to do it anymore unless you get a job there after 2022. So when you do your net learning modules for summer of 2022, you do not need to do it again for fall. They're good for a whole year. A few more reminders. You may use cell phones in our med-surg clinical areas. That's not an issue, because we need our phone apps to look up medications. However, in community is going to be a whole different situation. Community is exactly what it means. You're going to be in clients' homes. They may be apartment rooms. They may be lounges or public areas. So we do not want you to have your cell phones there at that time. It is too easy for students to record audio, video, take still photos of their clients that they're taking care of and innocently share it on social media. It's a tremendous violation of our clients' privacy. We do not know our clients' backgrounds as far as, are they protected from abuse? Are they potentially, and I just say this, potentially involved in something illegal, or do they have something going on where they may be in a situation where they're in court, where their identity can't be identified, like a witness? to a crime. So for those reasons, we don't want you to have cell phones during your community clinicals. Med-surg, you may have your cell phones, but community, you cannot. If you are in a situation where you need to have contact with your babysitters, families, employers, work with your clinical instructor regarding those issues. Your clinical instructors for community are very aware of situations. They're going to give you a lot more detail about the community clinical rotations than me. Also, make sure your Castle Branch information is always updated. That too is critical because we have to have, again, including faculty too, nursing students, nursing faculty, we all have to have our Castle Branch files updated at all times to keep compliant, because if we're not in compliance, then we don't have a nursing school. It's that simple. Any Castle Branch issues, questions, please reach out to Mrs. Bennett. I have no control over Castle Branch, and I have no control over Net Learning, Pearson, Red Shelf, ATI. That's all out of my control, just so you know. Clinical paperwork. Clinical paperwork for Nursing 250 is the same as Nursing 241, and it's going to be the same going into 251 in the fall. So, same paperwork as you're used to doing for 241, it's going to carry over to 250 as well. So you need to do 4 priority nursing diagnosis worksheets during your med-surg rotation in Nursing 250. You're doing a 1 patient, the worksheet, which again is a 2-page document. This is going to be new to a few students who are transferring into Nursing 250. I and your clinical faculty can help you with this documentation. The rest of you, this should be very similar, or you shouldn't have any questions because you've been using it for 240 and 241. Remember, students that don't have this filled out at the end of the clinical day are going to get a not met. And I always tell faculty, if you've had an extremely difficult day, very busy day, that will be taken into consideration. Main thing is you get it done and you upload a copy to your Dropbox for your specific clinical instructor. Again, for students that have been enrolled in HACC nursing programs, this should be very familiar. Just keep in mind that you do want to highlight the abnormals with some colored highlighter marker to help the faculty identify areas that you've identified as issues for the patient. Here, you're going to, again, point out some teaching need of the patient that's a priority. And then the sections that many students have issues with, medical interventions. These are things that the physician can do or related specialists can do. So ventilators, meds, other treatments that are done, wound care, surgeries, special tests, you can list there. And then the interventions, again, kind of repeat down below, which is a good example of what you can list for medical interventions. Nursing interventions, even though we are getting away from nursing care planning, we still want you to write out nursing interventions. Because these are the things that are writing these out, keep reviewing these, keep looking at these. These are the things that you're doing, you're going to be doing as RNs. So the more you do this is why we have you do this paperwork. The more you're writing out the nursing interventions, it's easier for you to remember what to do when you have a patient with upper respiratory infection, a diabetic that's unstable, a trauma patient with multiple extremity injuries, or a post-op patient of a particular surgery. Reviewing, constantly using these interventions help you remember them, so you're constantly using them again and again. Because this is the stuff that you're doing. This is the care that you're rendering as an RN. That's why we have you write it out, plus the rationale, so you understand what you're doing as an RN. And then collaborative care. This usually involves the ancillary teams, the specialists, the pharmacists, for example, therapy, respiratory therapy, PT, OT, case management, big piece of this collaborative care. I think case management, social worker involvement, you're going to get a greater understanding of that with the community clinical that you're going to experience in 250. Just like nursing 240, 241, you also have to do a pathway paper for nursing 250. Again, you do it on one patient, one time, and it's due in 1 week. And your clinical instructor will give you guidance with it. Again, same format, same process as in previous courses. Again, students that are new to HACC nursing that are coming into us from other nursing programs, this is a very lengthy process. Your classmates can give you some advice, but your clinical instructors will give you very good direction with it. Again, this example document and all the blank documents as far as clinical paperwork are on your D2L Clinical Nursing 250 course shell. So you can download them and print them out for clinical. Again, you're going to highlight areas that are of concern, which specifically are the concepts that you're pointing out with the pathway paper. And then don't forget to add your sources. We prefer their sources to be in APA format. And then finally, we come to our community clinical orientation. The clinical component of Nursing 250 is dramatically new for everybody. And myself, because I haven't taught the lecture portion of 250 before, I've always taught clinical. I have very little understanding of the community clinical aspect of this course, but that's why we have the clinical instructors that we do who do understand and do this community clinical rotation really well. And our site for summer is going to be B'nai B'rith. This is a Jewish low-income public housing complex in inner city Harrisburg. Some groups will be there during the day, some groups will be there into the evening. It provides housing for independent low-income housing individuals. Usually it's an older population. However, you may see people as young as 18 years of age. They have some permanent disability, whether it's a physical permanent disability or a mental permanent disability. So here then brings in many questions of safety, what you can and can't do. Again, your clinical instructors for community will give you the detail. They will give you the guidance. They'll give you the support with this clinical rotation, which I think for many students is only 3 days. With this, it is community. It's outside of acute care, so we do not wear uniforms. However, we still wear clothes. So please dress according to the guidelines that your clinical instructors tell you. They know to reach out to you by email prior to the beginning of this community rotation. Basically, you want to dress business casual. Again, you do not want to wear your casual summer clothing. You want to wear pants, shirts that cover your upper body. You want to wear underwear. You want to wear socks. You want to look decent. You want to look professional, but you don't have to wear formal business suits, formal business attire. It's between casual and business. And your clinical faculty will give you direction on that. We just cannot have you show up at community clinical dressed in capris with flip-flops or shorts and flip-flops and very thin or upper body garments that show most of your skin. That we can't have, and that goes for the men also. We still want you to have your hair neat. Guys, we still want you to have your hair neat, facial hair trimmed, because you are at this point beginning the process of acting like a professional. You're going to be professional registered nurses by the end of the year. So this is a time to really practice what it is to be professional. And for many students, this is all new. It's something they haven't done before. So this is a time to really practice being a healthcare professional, because in the guidelines of our State Board of Nursing for Pennsylvania, you truly are a nurse. You're given the designation of a student nurse within a registered nurse program. So yes, you are considered a health professional. So this is an opportunity to dress like one, to talk like one, and to act like one. So again, your clinical faculty, they're going to be reaching out to you by HACC mail the week of clinical, telling you how to dress, where to meet, where to park, and so forth. You're going to start your clinical at community in the community room. It's a large assembly room at Benai Breath, where you're just going to interact with these residents, which actually look forward to you coming to them. You're just going to be checking their blood pressure. You're going to be doing some other physical assessments, a lot of health education. Then you're going to go visit specific residents in groups. So you're going to see individual patients throughout that complex, again, in pairs or small groups. And that's all going to be determined by your clinical faculty member. You'll be playing interactive games with these residents on site. And at some point, again, this is going to be per your clinical faculty member for community. You're going to give a group project. And again, it's a 30-minute presentation regarding some educational need of your community residents that you're doing community help with. Your clinical faculty will tell you exactly what this is. I have no clue what it is, but they'll give you exact details. And they're going to be the ones grading it and giving you feedback as well. So that group project, again, is community only. You do not have this in med-surg. And your clinical faculty for community will give you direction when that time comes. With community, and for those that like to do more emergency care, you may in fact have an opportunity to render emergency care to these Benai Breath residents. And it usually happens every time our HACC students are there at Benai Breath. You could have someone in cardiac arrest, you can have someone overdosed, you can have someone having a stroke, having an MI, fallen, having an injured extremity. It has been a consistent thing where HACC students have assessed an injured patient, which we call them clients, and notified 911. So you may actually have an opportunity to render emergency care during this community experience. If you have Nursing 250 questions, please reach out to either me for med-surg questions or general course questions, or if you have specific clinical questions about community clinical, reach out to Mrs. Goodyear, and her email address is there. She's been doing the community clinical for several years. She is excellent at it. In fact, the students that just graduated had a tremendous amount of very positive comments because of Mrs. Goodyear's direction and intervention with this community clinical. So I'm hopeful that most of you have a very positive experience with the community clinical that, for the most part, Mrs. Goodyear does, but she has 3 other faculty working with her also. And that concludes this presentation regarding the orientation for Nursing 250.